I'm Katinka Blackford Newman, and welcome to the Med-Free Mental Fitness Podcast, the show where we explore what really supports emotional well-being without defaulting to medication as the first solution. Today, we're looking at one of the most pressing questions in modern mental health. Why are so many children being given psychiatric diagnoses? ADHD, autism, anxiety, depression, the rates are rising year on year. But are we uncovering hidden illnesses, or are we pathologizing what might be normal human variation, stress, or distress? My guest today is Dr. Sami Timimi, consultant child and adolescent psychiatrist, psychotherapist, and author of Searching for Normal, as well as many other books. Sami has worked inside mental health services for decades, and yet he has become one of the leading voices questioning the medical model applied to childhood. Welcome.
Thank you so much for inviting me.
Let's talk about your book, Searching for Normal, your most recent book. What led you to write that book?
One of the things that became clear as we were coming out of lockdowns was that we had a big surge in referral rates for all sorts of presentations. And what I was hearing from various people was that the numbers of people being diagnosed with various conditions was on a steep increase. It had already been increasing prior to the pandemic and the lockdown. And I think there's a whole set of harms potentially for young people, for families, but also for our society more broadly. And I wanted to, and I was just very lucky that at the time that these ideas were coming together that I wanted to write about.
So, of course, this is not the first time that you have questioned psychiatric diagnosis in this book, is it?
No, I've been predicting something like this for a long time. The time where I really began to understand what the problems with psychiatric diagnoses and the subjective nature was when I was a senior trainee in child and adolescent psychiatry. So this is going back to the mid-1990s. We didn't do any diagnosing. And there was only one person that we prescribed drugs for in the whole 9 months I was there. We worked often with pediatricians and we thought developmentally. And developmentally just means an understanding that things will change. Children change as they grow up. Then in this placement, it was in East London, and I was with a consultant who was very keen to understand a bit more about this concept that was beginning to filter its way into the UK, this idea of ADHD, attention deficit hyperactivity disorder. So he asked me if I wanted to join with him in doing some research. So my job was to go and do a literature review. So off I went and gathered all the papers that I could at that time and read through a number of books. And I had this very unsettling feeling. I was reading all these papers and I was trying to get a sense of, okay, so what is this ADHD? You're talking about it in all these papers. You're talking about prevalence. You're talking about symptoms. You're talking about potential treatments, prognosis, all of these kind of things. But I still don't get a sense of what you mean by ADHD. You just seem to be assuming what was being called ADHD was literally just the behaviors of poor attention, hyperactivity, and impulsivity. These are very generic types of behaviors. These are things that all of us have to some degree. And surely it's context dependent, at least at least to some degree context dependent. So there was an assumption, and I was seeing it at its inception and realizing there was no scientific basis to this. There was an assumption that there was something here, and the assumption was simply taken for granted and used as the starting point for building a set of knowledge, which, if the basic assumption doesn't have any validity to it, which as far as I could see, it hadn't been established, then all of that knowledge that's been built around it ceases to be valid too. So that was my starting point. So, we're going back to the mid to late 1990s. That was when I was starting to question, because it got me questioning the other things that I had been taking for granted. And so I'd been following, so ADHD was, if you like, my way in, and I'd been following the literature ever since.
So what were the other
And
diagnoses that you suddenly quite started to question at then?
um, it began me on a journey towards questioning all of the psychiatric diagnoses, right up to psychosis. I eventually concluded that diagnosis is just a system of classification. When you've got a cough, you'll go to your doctor. The cough that won't go away, you go to your doctor because you want to understand the cause of that cough, because that's going to make a big difference to the type of treatment. And the doctor can listen to your chest, can take an x-ray, can do a peak flow meter. But what the doctor won't do, and if they do this, they might get struck off, is sit down, do a questionnaire, tick some boxes, how often, what often, and then diagnose you with something followed by the word disorder. You have a recurrent cough disorder, and you should be suspicious whenever you see the word disorder after it. This to me is like a um, a mechanism, a linguistic mechanism to make it seem as if we know how to differentiate between something that we consider to be in the realm of the expected or the ordinary, and something that we consider to be in the realm of the clinical or the unhealthy or the abnormal. So we add the word disorder to it. And notice in most of the rest of the medicine, you don't get an asthma disorder, you don't get a diabetes disorder, you don't get a pneumonia disorder. They get specific. So um, I understood that what we have in psychiatry are not diagnoses. They cannot be diagnoses because they don't point to any proximal cause. They are descriptive. They are descriptive classifications and very bad descriptions. It's what narrative therapists would call a thin description. A thin description is something that excludes all sorts of other important aspects of your life, that is important to know. So I eventually concluded that we don't have diagnosis, but we are using the phrase diagnoses, and that is really harmful because it's internalizing to people an idea that there's something wrong, something broken, something dysfunctional. And when you classify experiences and behaviors as symptoms, well, what do you do with symptoms? You try and get rid of them. So it creates a situation where people are effectively being encouraged to view certain experiences as meaningless torture rather than something that might be meaningful or understandable responses to situations that happen.
All right. So, Sami, can you explain in layman's terms how these diagnoses are made? How these labels like ADHD, bipolar, all of these things, how they actually come about?
We do a lot of dancing around pretending that there's some uh, very involved expertise, and we call them tests, but all they are the equivalent of pop psychology questionnaires. That's it. They are questionnaires, and you tick boxes, so I'll give you an example. One of the symptoms that are, or so-called symptoms that you would tick a box is in ADHD is um, often runs around as if driven by a motor. So what does run around mean? How often is often? Um, how far would you have to run to qualify as one unit of running around? You can't escape subjectivity. So all of these so-called tests do is measure an opinion of a subjective opinion of somebody at a particular moment in time. And when it comes to children, you're measuring the opinion of somebody at a particular moment in time of somebody else, because it's usually the parents and or teachers who would be filling in these questionnaires. This is not a test. This is about as sophisticated as doing something to do with your star signs. It's vague. These are descriptions of behaviours and experiences that are common to all of us to some degree or another, but they also exclude context. So I've done some of these tests. If I went for a diagnosis of autism, and I've done the training on all of these instruments, and they are really subjective. They don't measure anything internal to the body, but I would qualify for a diagnosis of autism. But I wouldn't want to go down that pathway. And when you're reading some of these tests, you realize that they are assuming that all of these things come from internal and have nothing to do with context. They're junk science. This is not medicine. There's nothing medical about them.
Okay, so this is we're just in the land of bullshit, really, is what you're saying.
Absolutely.
Right.
It really is. It really is. I mean, back in the Victorian era, there was a movement called phrenology. I don't know if you've heard of that.
I haven't, no. What is it?
Phrenology was very popular, and there were scientific journals published about it, and it went on for decades. In fact, the Phrenology Society in this country, I think, finally closed its doors in the 1950s. That's how long it went on. But it was this idea that the bumps on your head, the skull shape, that there were different parts of the brain that were bigger or smaller, and that you could tell all sorts of things about the person, about their psychology, about the type of jobs, about the type of relationships, about the type of problems. And these phrenology readings were really popular in Victorian times. People would pay a lot of money to go and get their, these measuring instruments. This is what we've got. We've got the modern version of phrenology. It's total junk. Nobody's looking at the brains. You can't examine a thought under a microscope. There's nothing empirical going on that points to anything specific going on in the brains or bodies of people getting psychiatric diagnoses.
Okay, so that's quite alarming, isn't it? That there is this huge rise in diagnosis, and you're saying that there is nothing scientific about this, and that it's about as useful as working out your characteristics from a star sign. Is that right?
Absolutely, yeah. It is upside down science. Science starts with the idea that you have a hypothesis, particularly in medical science. You have a hypothesis, you have a theory, but you must assume that your theory is wrong until you have the evidence to support your theory. You don't do it the other way around. You don't start assuming your theory is right and ask the critics of your theory to prove that your theory is wrong. The only thing that critics need to do, this is in what happens in conventional science, the only thing that critics need to do is show that you do not have the evidence to support your theory. That's it. That's what, and as long as that's the case, you cannot, in scientific terms, accept your theory as valid. You have to assume your theory is not valid. So when those who support the concept of, for example, autism as it's construed these days, say that autism is a neurodevelopmental condition that's genetically inherited or genetically that a large component of it is genetic. Well, you have to show the evidence. You have to show the evidence at the molecular genetic level that there is a genetic link with what we call autism these days. And they haven't shown that. You have to show that there is a neurodevelopmental, in other words, something about the development of the brain, the nervous system, that is characteristically and specifically either abnormal or at least different. And they've done thousands, billions of pounds of research and cannot find the specific thing. And my prediction is they will never find the specific thing because there is nothing that hangs together as what we would consider in medicine caseness. In other words, you're not comparing like with like because you have no external empirical anchor. When somebody has high blood sugar, you could measure it. It's external to the subjectivity of the diagnoser. And you might have debates about where the cutoff should be, but you now have a group of people who have a certain high blood sugar, and you now have a group of people who do have something factual, biological in common. You can start building a knowledge base around that. You have the starting point for caseness, but we don't have that in psychiatry. Nobody's getting their brain scans to say, yeah, this is the abnormality. You don't have a blood test for ADHD, and you never will have because it's generic behaviors, context dependent behaviors, and there is not a starting point for that concept of caseness.
Okay. So I have had people with who friends of mine who are so happy to have an ADHD diagnosis who have said, "Oh, that you can see this on brain scans." Have you?
And
You must,
have any of them had a brain scan to see it?
no, but they will give me very good evidence that there have been brain scans on people with ADHD,
No.
and there's I can't remember the details, but is this the land of bullshit again?
I'm afraid it is. I'm afraid it is. I've been following all the research on genetics and on neuroimaging and on chemical imbalances. And basically, the picture is consistent inconsistencies. And to me, it's a bit like betting on every horse in the race and celebrating your efficacy as a pundit. One research group will find, oh, this little bit of the brain is slightly bigger or slightly smaller. The next research group will come along and find the opposite or find a different part of the brain
Okay.
that equates to the diagnosis.
Can you give me some sort of idea of the surge in diagnoses, because it is huge, isn't it? And you're at the cutting edge of that.
My colleague in Scotland, he was telling me that there is about 40% of children in Scotland are now registered as having some sort of special educational needs. And the majority of that has been the rise in mental health and neurodevelopmental diagnoses. I was traveling in Ireland a little while ago, and on the radio popped a program where they were talking about the rise in autism and the needs of kids with autism. And they were saying that in Ireland, that is now going at 5% of children in the education system. Where how did we end up with going from a condition that was originally reserved for considered a very rare condition of a prevalence of about between 1 in 10,000 and 4 in 10,000 in the early studies back in the 60s, and with kids who had significant learning difficulties, many of whom would be unable to live independently, need a lot of support in daily living. How did we go from that to Elon Musk, the richest man in the world, who apparently also has autism?
Yeah, but Sami, other people will be going, yippee, that's fantastic. All of these undiagnosed, these people going around with undiagnosed ADHD, undiagnosed autism, undiagnosed bipolar. Hooray! They've got a diagnosis and they're now being looked after in the way that they should be. What would you say to that?
Are they? what is the unintended consequences of creating an idea that we have a diagnosis, that we have an explanation when you don't? Um, you risk a number of things. First of all, you risk disabling people unnecessarily. You might think it's great that you've got an explanation, but you've now got a label, and particularly for kids, you've now got a label that is essentially saying there's something about you that makes it more difficult than the rest of the population to cope with the social world around you. It is basically the idea of a disorder at the end of it, even if you're considering it as a difference. That doesn't sound very liberating to me. So what started to see even in young people, let alone in adults, and you'll see this a lot in adults, that great, got a diagnosis of autism. That explains a lot. Of course, it doesn't explain anything because it's a description, it's not an explanation. And then a year, 2 years down the line, actually, that isn't explaining everything. Problems still carrying on. And so now there's a sense that maybe there's something else going on. And you might start getting a second diagnosis. So I've seen young people, they're only 16, 17 years old, and they've already accumulated diagnosis of ADHD, autism, PTSD, anxiety disorder, and they're still coming with their parents to say, no, I think there's something more going on. We now wonder if there is a bipolar disorder underneath that as well. And by then, you've started accumulating psychiatric medications on top of that. And so you're also dealing with side effects of medications, which are now being interpreted as possibly other conditions. So you end up accidentally disabling a group of the population. And we're seeing it now. Young people are struggling to cope with the demands of the world that we're in. And the other thing that I kind of, I'll be honest, I'm kind of coming to resent is that we've created kind of an almost cult-like uh, groupings of people who say that society isn't fit for them, but the neurotypical, because it's a society built for neurotypicals, for example, rather than for neurodiverse, without thinking that maybe us neurotypicals, and as I said, I could be categorized as neurodiverse. In fact, all of us are neurodiverse by definition, but um, us neurotypicals are also struggling with the same um, difficulties that our culture, our society, our economics, our politics are throwing at us. Um, uh, and in a weird way, it becomes uh, a set of almost entitlements that we should be getting special treatment because we're neurodiverse. And you neurotypicals are the ones who are oppressing us.
So, can I ask you, can a diagnosis ever be useful?
In my opinion, no, not a psychiatric one, um, uh, because of its unintended consequences on individuals, but more broadly on society. And because we have so much data now that says that our mental health outcomes are getting worse at the same time as there is an increase in use of diagnosis, use of psychiatric medication, and use of all types of mental health services. So in those societies that are most using them, they tend to be the societies with the worst mental health outcomes. And young people in particular seem to be one of the worst groups affected. So you can see at a population level, what we're doing is actually not helping and quite possibly making things worse. Um, I understand that for individuals, it can feel like a helpful thing. And to me, it's a bit like a cruel hope. It offers a hope. Now I understand myself. So it gives you a sense, oh, that's why I'm struggling. And as I've been explaining, that shifts away from the things that might make a bigger difference to all of us, which is in the nature of our politics and our economic system, and understanding that your feelings like that relate more to the situation, the context, the environments, the things that have happened to you, the various adversities that have gone on. That's more likely to be a important driver of the way that you are feeling. And because it never quite satisfies that sense that you've got that explanation, unfortunately, the diagnostic paradigm invites you into patienthood as an identity. And that's not good for anyone.
So I think what you're saying is that it actually disempowers people. It actually stops people from coming from a place of self-responsibility, because they can go, oh, right, that's my ADHD head or my autistic mind or whatever. And so therefore I won't make an effort. Is that what you're saying?
That can be one of the things, but disempowerment is very central, I think.
The other outcome as well is how much it is actually costing our economy as well, that all of these people.
It's unsustainable.
Mhm.
It's unsustainable. Our special needs system is unsustainable. You know, the numbers of people who are needing extra support, extra help, getting extra time in exams. And why wouldn't the rest of the pupils feel resentful about more and more pupils getting extra time in exams, for example? There was a ridiculous thing which just shows how absurd it's all become. That in the University of Oxford, they started giving pupils who have neurodevelopmental disorders like ADHD extra time in exams. And then they did a survey, and so people knew about that. And in the screening survey, they followed up with some further um, kind of questionnaires and so on. They came to the conclusion that 90% of students potentially have ADHD. This is in the top performing university in the country. So it is quite absurd and unsustainable. But we've also seen the same, like in disability allowances. Mental health is the number one driver of the increasing numbers of people. That's not good for people to find themselves trapped in that way. Um,
So you're saying
uh,
that they don't have a mental health disorder at all, effectively.
well,
They've been talked into it. Is that what you're saying? That a lot of these people who think that they have a mental health disorder, that they don't.
well, I'm questioning the whole concept of the way we imagine and understand. One of the problems of getting too immersed in the idea that we don't have mental health disorders is, of course, a lot of people do have states of mind that can be extremely disabling and that they need support. I'm certainly not, I'm certainly in favor of the importance of good, what we call mental health services at the moment. But what I want to see is a genuine paradigm shift away from using these pseudo diagnostic constructs. Good mental health systems should be about helping people recover and get on with their life. And I've seen it. I've seen it in practice. I've seen people who've been in the deepest of despair, unable to function for years, and I've seen people make full recoveries. A system like that is what I might call psychiatry light. It'll be much more light touch in terms of people's lives. It would be very low levels of use of medication compared to what we use now. You know, some people do find it really useful to have somewhere where they can talk, where somebody's helping them make sense of things, where somebody's noticing things that they didn't notice.
Totally. So in terms of medication, you're not a big fan of psychiatric medication, are you?
The evidence, particularly in long-term outcomes, is, if anything, they make things worse. We started using so-called antidepressants with young people, even though the early studies showed that there was no evidence that they are better than a placebo. And then we had the studies that showed that they actually increase the likelihood of a person attempting suicide. And I believe I've come across cases where I believe that that has been a major trigger for why somebody attempted and succeeded in ending their life. So with antidepressants, even the short-term studies don't show that they have any great benefits over placebo, but we know they have all these side effects, and these side effects accumulate over time. Stimulants, long-term outcome studies suggest that whatever short-term benefits they might have had, and again, it's hard to understand how much of it might have been placebo, they tend to wear off over time. So if you follow them for a number of years, and these are not things that are prescribed for a few months, these are things that are prescribed for a few years, and often people are told that they're going to be prescribed for a lifetime. So I've come across young people who are reaching 18, and all the problems are back again, and they're on 3 times the maximum dose. I've seen young people on 3 times the maximum. So
Of
they've just been
stimulants?
of stimulants. Yeah,
Wow.
so they've just been inducted into becoming. I mean, and these are, as you know, stimulants are highly addictive. They are amphetamine analogs. They're the sorts of substances that we'd correctly warn the rest of the population about their dangers.
Bec-
And even the use of antipsychotics now. And antipsychotics, these are very toxic drugs, and they do have a place, but it's a very marginal place. But they're being used for behavioral presentations increasingly, just as a way of suppressing behavior. So there are all these worrying trends.
So ADHD meds, of course, are like speed, or they are speed. Is that right?
Yeah. So ADHD drugs, or so-called ADHD drugs, are basically amphetamines or amphetamine-like substances. They work in the same way as cocaine, as speed, and as the types of substances that we correctly warn the rest of the population against consuming because of the large potential for harms that come from them.
And yet we're giving them to children who are, I mean, as young as how young are kids that you've seen who are being given ADHD meds?
Well, it depends where you are, but they're not licensed for under 6, but I have seen them being given to under 6.
So basically, you've seen children under 6 being given medication that is either
Mm.
that is similar to, well, that is speed or that is like speed,
Yeah,
right?
yeah, yeah, yes.
And
And
every day.
that practice is much more widespread in the US. That's
Yes.
quite common for young kids to be, kids under 6 to be prescribed stimulants. It's scandalous.
Yes.
What else can I say?
Okay. So what is there instead? If there isn't, you're not a great fan of meds, what
Mm.
is there instead then for kids who are struggling?
The potential for recovery is always there. My starting point when people walk through the door is to assume that what they're experiencing can be thought of in the realm of the ordinary and or understandable. I always have the idea that there is something within you that will find a way through. I don't know how long that will take. I don't know when the penny will drop, but it happens. And I've been really impressed by the resilience that people have, by the capacity of the human spirit to find its way through. And I've seen so many people who have recovered despite being in such dire straits.
So, what is one thing that parents could do to support a child who is struggling without medication?
Just be patient with them. One of the things that I would um, ask people to think about is the importance of what I call the emotional flow in relationships. So the importance of keeping a relationship going and focusing more on your relationship over the idea of controlling or solving a concern or an irritation in the behavior or a frustration that you have with your child or young person. If young people feel that they're loved and accepted, that's half the battle.
And of course, what you're saying is that labeling is sort of the opposite of that, isn't it? It's sort of
It is.
saying, look,
Yeah.
there's something wrong with you. And I suppose, do you think there's been anything helpful about the neurodiversity movement?
No, I think it's been unhelpful. I've come to that conclusion.
And I suppose it's also about what things lead to as well. So
Yeah.
effectively, what you're saying is that these diagnoses, they're not facts, they are
No.
beliefs, right?
Yes.
And
Yeah.
so if it's a belief, and this is something I work with I now work as a life coach, as well as doing the writing that you know about. And so it's an interesting distinction, isn't it? A fact or a belief. And so then if you look at a belief, that's changeable. And so then like to encourage people to think, right, is this an empowering belief or is it a disempowering belief? So if you look at something like ADHD, does that actually empower you or does that disempower you? Because actually, if you're going on to take medication and making it an excuse for not developing coping mechanisms, then that's not very helpful, I guess, is it?
Yeah, that's disempowering.
It's
Yeah, you're
disempowering.
right.
Right.
I
Yeah.
call them facts of culture, not facts of nature.
Yeah. But conversely, then on the other side of the coin, I think about my own daughter who had the label of dyspraxia, right? And she was really, really unable to read shapes. Like she couldn't read and still can't read an analog watch and couldn't read music. And actually that label was quite helpful. She didn't take any medication. She didn't make it an excuse for anything. It just gave her some kind of clarity about things that she couldn't do. She just wasn't able to read music very well. So she had to kind of like work her way around that. So in some ways that label was kind of okay.
And it also pointed to certain, I presume, educational interventions that might be helpful.
Yes, absolutely. And I myself have, think I might have dyspraxia and I make it a big excuse as to why I can't park my car.
Maybe I've got that. My parking has got worse over the years. I blame it on those cameras at the back. I think since I've started using the cameras at the back, my parking has got terrible.
So, Sami, tell me something. Just why is your book called Searching for Normal in a nutshell?
It's a kind of tongue in cheek because there has been a big narrowing of what we consider to be, I prefer now the term ordinary and or understandable. But at the end of the book, I conclude that up close, no one is normal. So I'm actually questioning the whole concept of normal and how it expands and contracts. But at the moment, we're going through a process of that idea of normal contracting and contracting and contracting.
So effectively, we're all neurodiverse, aren't we? Because everybody's different.
Well, that's the obvious thing. It's a bonkers category because there is no way you can differentiate between a group who are called neurodiverse and a group who are called neurotypical, because by definition we're all unique. There's only one of you. There's only one of me.
So finally, Sami, what would you do if you were health minister?
One would be I would remove any neurodiversity or psychiatric diagnosis from educational healthcare plans. In other words, from special needs support. I think that has to be done at an individual and functional basis. It shouldn't be dependent on any of these categories. Second thing I would do is I would remove all of the universal mental health education programs in school. These have been making things worse, and all the evidence is that they make things worse. And the third thing I would do is I would take neurodiversity out of disability living allowance. At least that's one thing that might take some incentive out for this ridiculous concept. So I think we should do that with the whole ADHD, autism, neurodiversity as a starting point.
And what do you think the effect of that would be, apart from you having a lot of hate mail?
It would at least take them out as an idea that this is something that leads to some specific extra help just because you have a neurodiversity. I would want when I was first working in child psychiatry, I used to do a lot of work with schools. All their special needs support was all done on an individualized basis. There was no diagnosis involved in making those decisions. I think that's a good thing.
It is a good thing, but I have to say, just playing devil's advocate, is that I do have people who say, oh, this ADHD diagnosis, it's just so helped me. I just completely understand why I'm not able to focus on things and why I can't tidy things and so on and so forth. It's just so liberated me. I mean, you must see this all the time. What do you say to that?
But it's not an explanation.
It might help them.
There is but there is a reality here. There is, you've got a label, you've not got an explanation.
Yeah, but that label has helped them, they think.
Yeah, that's fair enough. On you go with it.
And what's wrong with that?
Yeah, that's fine. But as I say, it's not an explanation. I think you need to be honest with people. They have not got an explanation. There's nothing specific. That's just they've got a descriptive, something of a description.
So about as useful as a horoscope then. If I was to say, look, I've just discovered why I have this passion for justice because I'm a Libra.
Yeah. Yes. I'm afraid it is.
Right.
Maybe horoscopes might be a bit less toxic potentially.
Well, I suppose they don't lead to taking dangerous medication. Generally, I've never heard of anybody taking medication as a result of realizing their star sign. But that may happen.
They may happen, yes. Who knows? Yeah.
Brilliant. Thank you, Sami. What I'm taking from this conversation is that children are not broken. Their behaviours, their emotions, their struggles are communication. Maybe the most powerful shift we can make is to move from asking what's wrong with this child to what has this child been trying to cope with. And when we do that, we create the possibility of change, resilience, and connection without medicalising a whole generation. Thank you for listening. If this conversation resonated, please share it, subscribe, and leave a review. It really helps these ideas reach the people who need them. See you next time, and thank you so much, Sami.
Thank you so much for inviting me. And that's a good summary, by the way.